How many of you think breast cancer only shows up as a lump, like a tumor, like something hard? Well, that was me, guys, but that is not the case. There are a lot of rare breast cancers that don't show up as a lump or a bump. Some of them are inflammatory and Pageants disease. These two are not talked about enough, and I know many people on social media that are asking a lot of questions about these two types because they are very hard to diagnose. Even some of the gynecologists can't even figure out what these two types are or diagnose them. So let's talk about Pageants disease. It is a rare type of breast cancer that begins in the ducts of the you-know-what and spreads throughout the surface and areola. It is named after Sir James Pageant, an actual surgeon, an English surgeon who first describes the disease in 1874. Pageants disease often presents with visible skin changes and is commonly associated with an underlying ductal carcinoma, DCIS, in situ, or invasive breast cancer. So what are the symptoms and how do you know it's Pageants disease? Well, the most common are redness, scaliness, flakiness of the area, often resembling eczema or dermatitis. And a lot of survivors are getting misdiagnosed, pushed aside, given skin cream and saying you'll be fine. So I want to make sure people realize that the itching and the tingling or the burning sensations in this area is a red flag and you need to speak up. So some of the discharge you might see, which might be bloody or straw colored, the retraction or inversion of this area, a lump or thickening of the breast may indicate an underlying breast cancer. This is not talked about enough. So it's important to note that these symptoms can mimic other benign skin conditions, leading to a delayed diagnosis. That's why I really want to get this out here. If you experience any persistent change in your area here, guys, it's crucial to consult with your healthcare provider right away. This information is coming from my medical advisor, Dr. Charles Weaver. He's a medical oncologist. We did a whole huge project on all the different types of breast cancer. So Pageants disease is very, very, very hard to diagnose. So if you see something similar to what I mentioned or feel like something's just not right, please talk to your gynecologist, raise your hand and keep pushing. I know way too many people that have been pushed off for at least even 18 months. Learn, Look, Locate, follow for more, guys. Pageants disease. It is a rare form of breast cancer and it does not show up as a lump. I hope you found this helpful. Please pass this on to anyone who might be experiencing any of these types of symptoms.